Hello, everybody. Welcome to the video. I had so much time thinking about how hard this video would be in making it. There's a lot of features for the skull, and it's quite a lot to study. But thank God the way I'm gonna do it is just split it into parts and surfaces that I'm gonna discuss. First, I want to go over all of the external features of it. Then I will splice it or slice it into, let's say, a transverse section, and then we can possibly look into the inside of it, and that's how we're going to do it. I'll probably put the external surfaces into one video, and then discuss the internal features in a next second video. So, all right. So first off, this is looking at your skull from superiorly. So in the name of it is called Norma Verticalis. Okay. If you want to just have a look at what I'm looking at, so that's the skull right here, and I am looking at the superior part of it and what makes it here, the Norma Verticalis, and um, what makes this surface. This is called the roof of the skull, in other words, or the vault of the skull. And we're going to mention and discuss all of the specific important features, the bones that make it, the borders of the roof of the skull, because these are very important points to bring up. Okay. To start with, the roof of the skull, or the vault of the skull, is made up of 4 bones. And there are the frontal bone, as you guys see here, it's labeled frontal bone. And that's the frontal bone, makes part of the roof of the skull. Then we have the 2 parietal bones, which come as paired bones, 1 and 2. So that's parietal 1, parietal 2, left and right. And then we have occipital bone posteriorly. That's this part right here is called the occipital bone. Okay, so very straightforward, I would say. Vault of the skull is made up of 4 bones: the frontal, the 2 parietal, and the occipital. Now we're going to discuss the sutures of it. Now we mentioned the bones. Now we want to talk about the sutures that separate them, the joints. Remember when we talked about fibrous joints? We said that sutures are part of the fibrous joints of the body, and we said that the joints are found in the skull. Basically, these are the joints here between the frontal bone and the 2 parietal bones here. This is called the coronal suture. Coronal suture. Those names are very important to remember. Then you have the joint that is found between the 2 parietal bones. It's called the sagittal suture. And finally, we have the final one between the 2 parietal bones and the occipital on the posterior aspect, and you can see it right there. We have the lambdoid suture. Okay, so these are the sutures, and they are fibrous. So this means that there's an interosseous membrane or fibrous articulation tissue between the bones within those sutures. Now we finished the sutures. We're going to talk about the important parts of the skull. They are just general features that for you to remember. And let's start with the point where the coronal suture meets the sagittal suture. This part is called the bregma, okay, and it's found between the 3 bones here, so the frontal and the 2 parietals. Okay, now we're going to move on to a second important landmark, which is called the lambda. It is between the sagittal suture and the lambdoid suture, and it's called the lambda. So lambda, bregma. And now, if you touch your head, there's like the most highest part of your head. Like if you stand straight and people would measure your height, they would put the measurement scale on this point. And that point is found just on the medial distance here, just dividing the sagittal suture into the exact distance front and back. It's called the vertex. And you can see this labeled here, vertex, front bregma, posterior lambda. Okay, so these are the mainly important features to remember that I really studied for the roof of the skull. Some other important stuff can be the two frontal eminence. So um, if you just touch right here somewhere on your um, front part of the head, you can find that the frontal eminences are found. They're just important landmarks. What else? We have, um, they've mentioned here about fontanelles, and I think one time I've received an issue about the fontanelles related to the skull. And those fontanelles are basically soft spaces found in the head of a newly born infant. And if you feel his head, you would see that in some certain aspects of his head, you'd find very, very soft parts, and you can actually poke them, and you'll see that it's only skin with underlying tissue. And the bregma it's an ossified spot, okay? But when the baby is born, the anterior fontanelle is found to be present. And with time, with growth, this fontanelle or tissue ossifies and it becomes all bone. Same here, posterior fontanelle, right here, um, at the lambda, posterior fontanelle is found. And you can see them labeled here, and you can read about them if you want even more. There's also regions where uh, there's the sphenoidal fontanelle right here and the mastoidal fontanelle right here. And these are also found on both sides here and here, on the right and the left. But there's only one anterior fontanelle and one posterior fontanelles, but there's two sphenoidal and two mastoidal. Okay, these fontanelles were actually one of the practical issues that we've had, and that's why sometimes really important to know what they are and when they get ossified into bone, at what growth age, let's say 3 months into growth, 12 months into growth, and that's some important things that you have to remember. Okay, so we have finished the general important features of the what is it called? The Norma verticalis, and that's the skull. But before I go to the Norma occipitalis, I want you to remember the borders of the roof of the skull. Remember, this point actually was a major shifting point to have so many students fail because of it. So Sariski would be very cruel to ask for the roof of the skull borders. So what does it mean? He's saying the vault of the skull, what is its borders? Imagine that this roof right here is cut like that and removed. Okay, so you will see that there's a slice. For example, if I slice it like that, you see that, okay, that's a slice, but I hope I can just switch it. Yeah, you see? So we have removed that vault. And he sometimes would like to hear what the borders are. And this made so many students actually from our year really, really disturbed, because like he would say, what are the borders? But he never taught them to us. And the vault of the skull borders, and I would quote from a very close friend of mine who uh, actually was a nurse, and he knows those things way better than all of us, and he sent us this answer, and we all used it, and I hope it's right. Just give me a second. It will be somewhere around the superior orbital margins, like, sorry, just give me a second. Superior orbital margins, it will be cut through those right here, just above your eyes. That's number one. That's the number one border. And then it will go through the external acoustic meatus, and then it will reach the occipital protuberance. So 1, 2, and then at the back, the occipital protuberance. And that line connecting those 3 points is actually the border of the roof of the skull. Okay, very, very important. If you've ever been asked about the roof of the skull borders, this is what you say: margins of the superior orbital fissure, superior orbital, the superior supraorbital margins. Then you have the external acoustic meatus and the occipital protuberance on the back. So this is basically it. Okay. That's it for the roof of the skull, taking it and really diving into its features. Some other stuff may be involved, such as the parietal emissionary foramen. They're found here just on the 2 lateral aspects of the sagittal suture within the structures of the parietal bones. Okay. And you can have the parietal eminences on the lateral aspects of the roof of the skull in the parietal bone structure. That's it for the roof of the skull, Norma verticalis. I'm going to move on. Okay, next we're going to be talking about the Norma Occipitalis, and that's found on the posterior aspect of the skull. I'm going to isolate this part, and then I'm going to rotate it to the posterior aspect. And we're going to just talk about, without this part of the skull, we're just going to talk about this view right here, including those 2 processes. Okay. Now I'm just going to get this here in the middle to see exactly what we're talking about. Now, the Norma Occipitalis, from its name, it's majorly made up of the big part, or the squamous part of the occipital bone, the 2 parietal bones, as we discussed, and the squamous part, and the 2 mastoid temporal bones. If you can see that this part right here, those processes are called mastoid processes, and they come from the temporal bones. What are temporal bones? Basically, this part right here is a temporal bone. And when we rotate and look at the Norma Occipitalis, which is the posterior aspect of our skull, we see the 2 parietals, the occipital, and the 2 mastoid temporal bones. Okay, very general features that we see here. We can see the parietal foramina. It's not found on this application, but they're found, and they're important landmarks for the passage of some veins. You have the lambda, as we discussed before. We have and see the lambdoid suture. We see the sagittal suture, and then we have the where is it? The inion, which is this part right here. It's the most protruded part found between the within the superior what is called nuchal line, and that part is called the inion, and it's a very important landmark within the structure of the posterior aspect of the skull. And the inion is actually, so how can you separate between the external occipital protuberance and the inion? The external occipital protuberance is this part right here, that is the most protruding part, okay, on the posterior aspect, but the tip of it is called the inion, okay? And we can see here superior nuchal line, inferior nuchal line, okay? And then we have the, what is it called? Just give me a second. we have, yes, so the special features that we see is the external occipital protuberance, as I said, lies between the lambda and the foramen magnum. Okay. Um, so that's the lambda, and that is the foramen magnum. And the external occipital protuberance is found right here. It is its upper part gives origin to the trapezius muscle. You will learn that in the future. And its lower part gives attachment to the upper part of the nuchal ligament, also something that you will learn in the future. So these landmarks are important to learn to understand when they tell you that this structure attaches to this part of the bone, you know what you're talking about. External occipital crest, that's the external occipital crest. It extends from the external occipital protuberance to the posterior border of the foramen magnum, from here to here. That's the external occipital crest. Okay, so all of those features that we're mentioning are very important. Gonna move on here. As I said, superior nuchal line from here to here. Sorry, from here to here. That's like all of it is the superior nuchal line. And then we have the inferior nuchal line. Okay, and then we have highest nuchal line, which is found above the superior nuchal line, but it's not really important. And then we have the mastoid emissionary foramen. This foramen right here is called the mastoid emissionary foramen, and from its name, it lies on the posterior aspect of the mastoid process. Okay, it's also found on this aspect right here, mastoid occipital foramen. The it gives rise for the emissionary vein. So emissionary vein passes out of these foramen. Okay, that's it. Basically, that's it for the Norma Occipitalis. We finished two parts, the superior, which is the verticalis, and the occipitalis. We're going to move on to the next one right now. Now, I want to go last into the Norma frontalis because it's the most dense part. I will just dive into the lateralis because it's a little bit more simpler. Keep hardest to last. Okay, so here we're going to discuss the lateral aspect of the skull. And directly when you talk about the lateral aspect of the skull, you've really got to mention, I mean, every part of the skull, but it's always important to have images within your brain when you start speaking about something. And anatomy is all about images, as we know of so far. So here, some bones that make up the lateral aspect of the lateralis, normal lateralis. Well, it's not some, it's actually a lot of them. But how I'll start with it is by saying the lateral aspect of the skull is superiorly made up of the frontal bone, the parietal bone, the temporal bone, some part of the occipital bone, sorry, here, the occipital bone, the sphenoidal bone, the zygomatic bone, okay, the mandible, the maxilla, the ethmoidal, the lacrimal, the nasal, and these are what I actually see, okay? So, as we said, superiorly, nasal, frontal, parietal. Here, nasal, frontal, parietal, superiorly. Inferiorly, maxilla, zygomatic, see here, maxilla, zygomatic, greater ring of the sphenoid bone, that's actually a very nice thing to point out, squamous and mastoid part of the temporal bone, right here, squamous part, and mastoidal part of the temporal bone. Okay. Then we have the squamous part of the occipital, as I mentioned. Okay. Right here, this part. It's playing games with me. There, the occipital bone. Okay. Very important to note. Okay. Some features, as we had like in the occipital part, we had nuchal lines, right? Superior, inferior. Now in this part, the lateral part, we have temporal lines. Why temporal is because it lies within majorly the near the temporal bone, but also it is a very important landmark for the attachment of the temporalis muscle. What I'm talking about are the superior and inferior temporal lines. Superior, inferior temporal lines. So superior is found the most superior part, and then just below it, the inferior temporal line. Okay, and those two lines are for the attachment, or they form the origin of the temporalis muscle, which is if you press on your teeth and put your hands here, you can feel it bulging. Okay, and temporalis muscle that attaches within this region is important for your mastication process during eating. Okay, um, so that's an important thing to know. You have also the mm, you have, okay, the supramastoid crest, which is this part. It reaches to the posterior end of the zygomatic process of the temporal bone right here. That's that part. You also have the zygomatic arch. The zygomatic arch is the um, it's an arch. You see this part is formed by the temporal process. Okay, that's the zygomatic bone, right? Well, I'm telling you, I don't know if you know it yet. That's the zygomatic bone, and it has this process right here. This process is called the temporal process because it's reaching towards the temporal bone, and also the zygomatic process of the temporal bone. And this right here, this structure, is called the zygomatic arch. Okay. I'm just going to mention them, and then I'm going to talk briefly over them just quickly to capture all of those things together. Um, the Yes, so here the supratemporal area, what they're talking about is between this superior temporal line and the inferior temporal line. Then you have the temporal fossa. This whole thing right here, the space, is called the temporal fossa for the presence of the temporalis muscle. The infratemporal fossa, it is found if when you see a skull, you can actually put your hand within the infratemporal fossa, which is bounded by the zygomatic arch. That's the infratemporal fossa. You can actually see it and put your hand through it. It's just lined laterally by um, the mandible. Like you can. So this is the mandible. This part right here, if we just medially to this part is the infratemporal fossa. Okay, and we can reach it by placing our finger and going down this part medially to the zygomatic arch to reach the infratemporal fossa. And some other parts that I'm going to talk about right now. let me see. So first, just to cap before going into so many details, because there's a lot to talk about on this part of the skull. Superiorly, nasal, frontal, parietal. Then we have this part right here. Um, before diving into it, maybe saying the inferior parts, we have the maxilla, we have the mandible, the zygomatic bone, the temporal bone squamous and mastoidal part, the squamous of the occipital bone, the greater wing of the sphenoid bone, okay? And all of those make the lateral aspect of the skull. Then we're going to talk about some important landmarks, such as the temporalis fossa, which is a house or a home for the temporalis muscle, the superior temporal line, inferior temporal line, um, which are the origins of the temporalis muscle, which is part of the mastication process of the digestion of food. Okay, so next we are going to dive um, into maybe some important landmarks. You see this part right here. This part, it's like not just like this whole part right here. If you concentrate, you can see an H letter. H. So line 1 in the middle, line 2. That H is called the pterion, and it's the weakest part of the skull. And if you get injured in that part, you will get a hematoma. Why? Is because that's the weakest part of the skull, and if you injure it, it's really easy to break. Among all of the regions of the skull, that's the easiest to break, and that pterion is formed by the H formed between the bones frontal, parietal, temporal, and the greater sphenoid wing. Okay? And you need to know this part as an important landmark within the skull. Laterally as well, that's the pterion, and here is called the asterion. Okay? It's the meeting point between the parietal, the occipital, and the mastoid temporal part. Okay? And remember, if I told you in the beginning of the video, there's the mastoid fontanelle. The mastoid fontanelle is found in this region. And the sphenoid fontanelle is found in the pterion region. Fontanelles are, again, they are soft parts of the skull within the structure of the baby's skull, okay? Some other important features, we see the external acoustic meatus, and basically that's just the bony part of the beginning of the middle ear. Okay, that's the external acoustic meatus. You can also see some other stuff such as the styloid um, process, okay, and of course the mastoid process. One important thing that you see, an important landmark in the lateral aspect of the skull, is the temporal mandibular joint between the temporal bone and the mandible. I think the coronoid process of the mandible. Okay. Um, what else? Let's see. Hmm. Yeah, as we said, external acostomiatus, mastoid process, styloid process, pterygomaxillary fissure, and the pterygopalatine fossa. I advise you guys to really dive into those parts because they are very, very, very tricky to observe through here, and I don't think through the application we're able to look at them. Let's see. Yeah, it's probably here. There. Let's see if we can look at this. Yeah, there's a space over there. Okay, so the pterygomaxillary fissure, it's a vertical slit between the upper parts of the pterygoid process posteriorly and the maxilla anteriorly. So, one second, how can I explain this? Um, so that's the maxilla. Just give me a second. So there is, for the sphenoid bone, when you study its structure, there is a process called the pterygoid process of the um, sphenoid bone, lateral pterygoid and the medial pterygoid, and it's really not visible here, but just know that the pterygomaxillary fissure, that right here, the slit is between the pterygoid, where is it? The pterygoid process posteriorly there, and the maxilla anteriorly. This whole thing extending here is also the maxilla. So this here is called the pterygomaxillary fissure. Once you go into this further, you don't reach the eye really. You reach a space which is in this shape right here called the pterygopalatine fossa. And for our practical, it was so tough to really understand this part. But fortunately enough, I had a skull between my hand. I could take apart and really know what this is. The pterygopalatine fossa, it's an inverted pyramid, just like an inverted pyramid. It's like a space, but inverted. Um, it's medial to the pterygomaxillary fissure. Medial means like deeper in, medial, right? So lateral, medial, okay? Um, it's behind the apex of the orbit. So like the orbit, just behind that, right here, if you go inside that, and then you just have to know the boundaries of it, because I think in your practical issues, he will bring it up, or in your oral issues, if he's so like, he wants to torture you or something, like that's something he would torture you with. So the like just know the boundaries. I think you'll be fine, because that what he wants, the anterior wall, posterior surface of the maxilla. Of course, that's the maxilla. If you look at it, that's the maxilla, right? Like everything here is the maxilla. The posterior aspect or surface of the maxilla makes up the anterior wall of this pterygopalatine fossa. The posterior wall is the pterygoid process of the sphenoid bone, okay, as we know. Medial wall, like towards the inside of it, perpendicular plate of the palatine bone. Palatine bone is a bone found, I can't take it apart right now. Let me see. It's a bone found just within the inside structure right here. Like if we take apart the maxilla, we can find the palatine bone. But let me just try and like search for it here. Okay, so let's get out palatine bone. There, palatine bone. Where is it? There. It's somewhere in there. You see it. So let me isolate it. Boom. That's the palatine bone. And parts of it, that's the horizontal plate. That's the pyramidal plate or process. That's the orbital. I think it's basically this part that we want to talk about. It's the horizontal horizontal plate of the palatine bone. Yes, so 1 second. It says perpendicular plate of the palatine bone. So I think it's this one. it's a really tough bone to really understand. Yeah, it's giving up on me. But you get the idea. It's part of the palatine bone. Um, when you learn about the palatine bone from Subota or whatever, you'll really understand where the perpendicular plate of the palatine bone is, and that is just basically the medial border, okay, of the pterygopalatine fossa. Okay, so just remember, you just have to remember it because like it's so hard to um, imagine it without having it within your hand and like looking at it really. It's really hard for me to get it out from through this application because it's so hard to look at. Laterally, it's the Maxillary Fissure. Okay, so we have mentioned this. If so, we said so that's the fissure, right? Of course, the fissure takes you to it. So that's the lateral aspect of the pterygopalatine fossa. So again, anterior wall maxilla, posterior wall pterygoid process of the sphenoid bone, um, medial wall perpendicular plate of the palatine, and the laterally, what takes us into it, laterally, most laterally, is the pterygomaxillary fissure. Okay? And it communicates, it says here, inferiorly with the infratemporal fossa. We didn't look at this. One second. So infratemporal fossa is basically right here. As I said, you go in here and behind the mandible, that space here is called the infratemporal fossa. Okay? I think I've bombarded you with so much information, but the skull is the skull, guys. Okay? That you will learn about in the future. The contents of the pterygopalatine fossa and stuff. It is so important to know what is inside of it. I think he is really interested to know if you really know those things, and so much information is listed here for you. Plus, how this fossa is connected to other parts of the brain through the foramina that we're going to talk about, and they're found inside. So, for example, the foramen rotundum takes things from the middle cranial fossa into the pterygopalatine fossa. The pterygoid canal, which takes the, I think, the Vedian artery, Vedian nerve to the pterygopalatine fossa. The palatovaginal, which takes the pharyngeal artery vein through artery and nerve to the pterygopalatine fossa. And those foramina are just holes that allow things to pass through through spaces of the skull. And it's so good if you can really study those things right now, because I think when he says pterygopalatine fossa, you really need to know all of those things about it. And I hope and I cross fingers that he doesn't put that as part of your oral issues, okay? Because it's tough to understand. Okay, so now we're gonna go, I think it's a good start or a good time to discuss the frontalis. I'll leave the basalis to the end. Frontalis. I'm sorry if the lateral aspect was so hard, but there's so much to be said about it. But yeah, we finish it. The frontalis. There. So the frontalis. Let me see if I can just move this here. Get this here. Okay. The frontalis is okay. Here we have we've talked about most of those bones, but let's just dive into it. So it's the anterior aspect of the skull. It's basically the bones that make up your facial expressions. The bones that are making it are the frontal bone right here. Yep, your frontal bone. Okay. You have the two zygomatic here and here. Okay, these are zygomatic bones. You really need to know their structure. I'll discuss in details how they formulate themselves around. Okay, and then you have the two maxillary bones here and here. So frontal, zygomatic, maxillary, and finally mandible. There are other things that also form the aspects of the skull, such as the frontalis, such as the nasalis right here, nasalis bones. And if let me zoom in, probably these are the nasalis, the two of them. They come in pairs. Okay, um, and of course, sutures are everywhere within the skull. Um, and they are very easy to remember because they're named according to the bones that surround them. For example, you have the frontonasal suture, frontal bone, nasal bone. So this part right here is called the frontonasal suture. Okay, the metopic suture right here is found between the two halves of the frontal bone, and not everybody has it. Because I think during the infant stage, the frontal bones are split and then they fuse. But don't mention that. Strixie just mentioned that the frontal bone is one piece. And then you have, for example, frontomaxillary suture, the maxillary bone, frontal bone, and this part right here is called the frontomaxillary suture. The zygomatico-maxillary suture, maxillary bone, zygomatic bone, zygomatico maxillary suture. Okay, intermaxillary suture is found between the two maxillas here, 1 and 2, and that's the intermaxillary suture. Just for your information about sutures. Okay, parts of the norma frontalis. The forehead is made up of the frontal bone. The middle part contains 3 cavities, 1, 2, and 3, the orbitals and nasal cavity. Lower part is formed by the upper jaw and the lower jaw. And that's how it's split here into the in the notes. Next, we're going to talk about very important features. Number 1, frontal eminence. And it's found right here, 1 and 2. The supraciliary arches here, supraciliary arches, and they're just found, well, not on like the edges of the orbits, but just above them. Like you can actually see mine. Okay, I'm too skinny of it, that's why. But yeah, you can actually see mine, and they're just called the superciliary arches. And this part, I remember it very well because Sersky says in a very funny way, he says glabella. That's the glabella, that's your glabella. Glabella. The nasion, the point of the meeting of the frontonasal and the internasal suture. And that is exactly right here. That's the nasion. That's the point where those sutures meet, okay? Supraorbital notch. Sersky likes this one very much. This part right here, you see it? Supraorbital notch. It's a notch. If you touch it, if you touch yourself right here, you can see that there's a dent. It's like an empty slot. Okay, it's not a foramen, it's not a circle, it's just a notch. Okay, there's no border that closes it, so it's just like curved right here. Okay, Then we have the nasal bones, of course. These are the nasal bones, as I told you. We have, of course, the zygomatic bones here and here. And you see like their structure is very, I'll just show you, like very weird. Okay. And you will see in the future that I'll explain something about their involvement within forming the orbit's walls. Okay. And they actually discuss it in here, so we just start with it. So the frontal process of the zygomatic bone. You see, it has so many processes. It has like this part. So that's the zygomatic bone. Okay. This part of the zygomatic bone right here is called the frontal process of the zygomatic bone. Why? It's because it articulates with the frontal bone. Easy. Now it has the maxillary process articulates with the maxillary bone. And finally, it has the temporal process articulates with the temporal bone. Okay. It has an orbital plate. This part right here, the zygomatic bone, right here, is the orbital plate. See? Why? Is because it forms the lateral wall, inside wall of the orbit. Okay? And finally, the zygomaticofacial foramen. Within the zygomatic structure, there is a foramen. This part right here is the foramen, the zygomaticofacial foramen. Okay? Okay, next we have the two maxillary bones, and we're going to just discuss their general features here. Sorry. The maxillary bone has a frontal process right here, which articulates with the frontal bone. It has a zygomatic process, which articulates with the zygomatic bone. So when you describe those things, you say the maxillary process articulates with the zygomatic bone through the its zygomatic process. So you say the zygomatic process of the maxillary bone articulates with the maxillary process of the zygomatic bone. It can be confusing, but it's very, very easy once you get your head around it. So you have the frontal process, zygomatic process, and the alveolar process. Why is it called alveolar process? Because it allows for the attachment of the teeth, the upper teeth. Okay, and it's mentioned here actually here, alveolar process. Okay, within the structure of the maxilla, we have got the infraorbital foramen. Okay, and within the structure of the frontal bone, just above the orbital arches, within the ciliary arches, you have the supraorbital foramens, and they are on the both sides, 1 and 2. And then you have the infraorbital foramens, and then you have, we're going to get to it, the mental foramen. And if you see, these three foramens lie on the same line. If you can draw this line straight ahead like this. Look, boom, and boom. These foramens lie on the same lines. Okay. Okay, what else? We have the orbital openings, these ones. Okay, supraorbital margin formed by the frontal bone, supraorbital margin. These margins right here. We're not talking about the ciliary margins, but the supraorbital margins formed by the frontal bone. The infraorbital margins formed by the zygomatic more medially, no, the maxillary more medially, and the zygomatic most laterally. Okay, lateral orbital margin formed by here, lateral orbital margin formed by the frontal and the zygomatic. Okay, so inferiorly zygomatic maxillary, laterally frontal zygomatic. Okay, medially frontal bone. Okay, and frontal process of the maxillary bone. And this margin of the orbitals is very important. You have to know them. Okay, anterior nasal aperture. This part right here is the anterior nasal aperture. Um, like the superior part of it. And that, like, it extends, boom. This aperture is formed superiorly, okay, by the nasal bones, okay. Below, it's formed by the maxilla on each side. And this looks like a pier, okay. That's the anterior nasal aperture. Um, And as I mentioned, foramina in the Norma Frontalis, you have the supraorbital notch, notch and foramen. So notch is here, foramen is here. You have the infraorbital foramen um, within the structure of the maxilla. You have the mental foramen, okay? And you have the zygomaticofacial foramen here and somewhere here, okay? So that's the general features of the frontalis. Wow, that was a lot. Okay, so you have the superior part, the roof. You have the occipitalis. You have the lateralis. You have the frontalis, and finally we have the basalis. Holy crap! It is so much, man. But like, you can do it. Okay. Um, the basal part. Okay. Let's go to the basalis. I hope I can just remove the mandible. Because the mandible, inferior part, just give me a second. Okay, so here, how we're gonna talk about it is separating this basal part. So that's the skull, okay, just to let you guys know what we're talking about exactly. Okay, there. So we just get it to the basal view, okay? I'm just gonna zoom in here. Okay, so we're gonna divide this into the anterior part, the middle part, and the posterior part. In the anterior part, you see a lot of features, and mainly it is made up of the, let's say, the alveolar arch that contains the all of the teeth, okay, and how this is separate, and you've really got to study this part. The alveolar arch is found to surround the palatine process of the maxillary bone. So you see, like, that's the maxillary bone, okay, that's the alveolar process, and then that is the palatine process. It forms the hard palate. Okay, the palatine process, it's mentioned here, palatine process, okay? It is, you don't see much here, but there's an incisive foramen right here, okay? And you can see the incisors, the canines, the premolars, and the molars, and teeth sockets are found to sit within that structure, okay? What structure we're looking at is like looking at the top of your mouth, okay? That's what we're looking at, okay? Um, each half is formed by anterior three-fourth formed by the palatine process of the maxillary bone. So what they're saying here, okay, saying that there's a median, what is it called? The median palatine suture, okay, that separates the because remember there's two axillas, right? So there's two palatine processes, one, two, and they're separated by the median palatine um, suture that is not shown here. And on the anterior side of the suture, there's the incisive foramen. Okay, posteriorly, this suture joins something called the palato-maxillary suture. Why? This is the palatine bone, and this is the maxillary bone. Still, I know we know that it's called the palatine process of the maxillary, but still it's the maxillary bone. So the palatine maxillary suture, this part, okay? And we have within the structure so many things. So let's just discuss it quickly. Alveolar arch, that is the alveolar arch containing the teeth. Then we have the posterior free border of the heart plate. Um, uh, so what they're saying is, you see this border, okay? This border is called the posterior free border of the heart plate. And if you put your tongue inside your mouth and try to touch the end just before the uvula, okay, you will see that there's a soft plate. The soft plate, okay, you can touch it with your tongue. If you extend it to the back, that soft plate is joined by the hard plate, separated by this border right here. Okay, and then we have the posterior nasal spine. Um, it is basically the spine that is well, it's not very clear here, but don't worry about this part. We don't need that much details when it comes to this. But wait, I want to mention something important. Yes, the foramina. So as I mentioned, the incisive foramina, okay, right here, and then you have the greater and the lesser, greater palatine foramina and the lesser palatine foramina, right here, okay? They're found within the structure of the palatine bone of the heart plate. So we have done that anterior part. Remember, alveolar arch, palatine processes of the maxillary bones, separated by the median palatine suture. The palatine process of the maxillary bones separate from the palatine bone by the palato-maxillary suture. The palatine bone contains the greater and lesser palatine foramens on either side. That's the under part. Now the middle part, it has so many structures as well, and the middle part is very well known for the foramina that is found in the structure. But let's begin with this very subtle bone found here. So anteriorly in the middle, that form the middle part, which is we're talking about this part right here. Boom, boom. This part, everything here. Okay. We have the femur. See, it's drawn right here. See, it's like a heart shaped. It is found here. That's the femur. This part is the femur. Okay. And then we have the body of the sphenoid bone. This part right here is the body of the sphenoid bone. Now we have the medial pterygoid plate of the sphenoid, lateral pterygoid plate, medial pterygoid plate, lateral pterygoid plate. So these are pterygoid processes of the sphenoid bone: 1, 2, 3, 4, and the femur. And then we have the infratemporal surface of the greater wing. This part, okay, I don't know how I'm going to show you this, but remember, greater wing, right? Okay. So this part right here of the greater wing is called the infratemporal surface of the greater wing. Boom and boom. Okay? Because that's the greater wing, right? Greater wing. If we just follow it, that surface is the infratemporal surface of the greater wing. That's anterolaterally. Okay? Anteriorly, laterally. Okay? Posterior laterally of this part, okay, we have the petrous part of the temporal bone, tympanic part of the temporal bone, and the mastoid part of the temporal bone. The petrous part is found in this region right here, because in the future, remember, when you will study that the inner ear is found within the petrous part of the temporal bone. Petrous part, okay? Tympanic part is found in this region just around the external acoustic meatus, and then you have the mastoid part of the temporal bone, okay? Remember, petrous, tympanic, mastoid, okay? Let's go in here. Okay. Then you have posteriorly in the middle, basilar part of the occipital bone, okay, and then laterally, two here. Wait, yeah. So petrous, basilar part of the occipital bone, okay. It's the base of the occipital bone, basically. Just giving you more aspects to look at. That's the basilar part of the occipital bone, and then you have two lateral parts of the occipital bone, okay. And these parts right here are the condylar processes of the occipital bone. Okay, so we have mentioned so many bones right here. To start with, femur. Boom, here we'll see femur. You have the medial pterygoid plate, lateral pterygoid plate, medial pterygoid plate, lateral pterygoid plate. You have the infra, as you remember. Hope you still remember, infratemporal surface of the greater wings. So we follow the greater wing, infratemporal surface of the greater wing, okay? Zoom in again. Okay, we have the basilar part of the occipital bone, and we have the lateral part of the occipital bone, the condylar processes. Now, in a bit, we're going to dive into the foramenas that lie within the middle part, but just after we discuss the posterior aspect of the basilar part of the skull. The features that we just mentioned, we have vomer, bone, pterygoid process of the sphenoid bone, we have the lateral pterygoid plate, we have the medial pterygoid plate. Just give me a second, sorry. Okay. And then we have the infratemporal surface of the sphenoid, okay, the basilar part of the occipital, petrous part of the temporal. You can read about the details within it, okay. And we're going to dive into, in a bit, the foramenas that are found within the basilar part of the skull. Before we go into the foramenas, I want to discuss just the posterior aspect of the skull, the basal, posterior aspect, the basal aspect of the skull. You have the general features here, the external occipital protuberance, which is found right here. Then you have the external occipital crest, just from the protuberance to the posterior margin of the foramen magnum. You have the superior nuchal line and the inferior nuchal line. Okay, and this posterior aspect of the skull allows for the attachments of many muscles, such as the ones mentioned here, but you're going to be studying mostly the capitis, the rectus capitis, and the post major and post minor. You will learn this about in the future, but like just know that these regions of the skull are very important for the attachments of some muscles that you learn in the future. Now I will just want to dive into foraminas of the skull, but I want to get out actually a very clear image of those foraminas because you need to know um, their how they look. Skull. Well, probably we'd have to basal view. Yeah, here. Yeah, CanHub is actually one of the most amazing places to look at things. Okay, so here, as we mentioned, you have to know most of the foraminas and the fissures that are present within the structure of um, the skull. So in the anterior part of the skull, you have three foraminas: the incisive foramina, the greater and the lesser palatine foraminas. So you have the incisive, you have the lesser, and you have the greater. So greater is right here, and lesser is right here. But on both sides, because just for labeling purposes, they're showing it like that. But you have the greater, lesser on each side. So that's the foraminas present in the anterior part of the basal view of the skull. The next ones are found within the three small ones are found within the middle part of this basal view of the skull. It's called the first one is called the foramen ovale, right here. Okay, then you have the foramen spinosum, right here behind it. So you have ovale spinosum, and then you have the stylomastoid foramen. It's near the, it's between the mastoid and the styloid process. The mastoid process and the styloid process is called the stylomastoid foramen. Okay, and it's found also on both sides, between the styloid process and the stylomastoid foramen. Okay, that's the smallest ones within the middle region. Again, ovale, spinosum, stylomastoid foramen, ovalo, spinosum, stylomastoid foramen. Then we have three large ones in the middle part, foramen lacrum, this one, right here on both sides, foramen lacrum, okay. Carotid canal, the carotid canal is, where is the carotid canal? Yep, it's right here, okay, 1, 2, okay. You can't see a white background in here because the angle of the carotid canal is weird. This is for the passage of the internal carotid artery, okay, carotid canals, right here, okay. Then you have the jugular foramen for the passage of the jugular vein just behind it. So carotid canal, jugular vein, carotid canal, jugular foramen, carotid canal, jugular foramen, lacrum, okay. And then you have, okay, these are not really important. Then you have the foramen related to the occipital condyles, okay. These are the occipital condyles, okay, that we're talking about right here. And you have the hypoglossal canal. Where is that? Hypoglossal canal. They're not labeled here, but they're found, they're just on the anterior part of each occipital condyle, just around this region right here. They're the hypoglossal canals, okay? And the posterocondylar foramen, boom, here and here. Posterocondylar, hypoglossal, but they're not labeled here, not shown. Then you have the foramen magnum. That's the largest foramina present in the skull, very large. Okay. Then we have more openings, but we turn into not really important stuff because remember palatovaginal. I've told you that the pharyngeal, yeah, there we go. Pharyngeal branch passes through this palatovaginal and it leads towards the pterygopalatine fossa. Very hard to look at, but if you have a skull within your hand and you can look at those things, it'll be nice. What else? Other stuff? Yeah, important ones. The fissures, the inferior orbital fissure. That's the one. It leads It's found between the greater sphenoid wing and the maxilla. Okay, um, and the infraorbital fissure does not lead towards the orbitals of the eye. The superior orbital fissure leads towards the orbitals of the eye. Um, Pterygomaxillary fissure, we talked about it. It's between the maxilla and the pterygoid process, and I've shown you just earlier in the video. What else important things? Um, yeah, we've talked about the process, the styloid process, the mastoid process. Um, yeah, this is for just muscle attachment in the future. That you don't need to know about this right now. And the cranial cavities, I'll talk about them in the next video. Now, for this video, we're done. We've covered the verticalis, the occipitalis, the frontalis, the lateralis, and the basalis. Now I'm going to dive into cutting it transversely and looking into the what the brain sits on. Okay, what does it sit on? It sits on three main important parts: the anterior cranial fossa, the posterior cranial fossa, and between them the middle cranial fossa. And how you can see those like foramenas, what they lead into, and you can actually see looking at the skull through this view. I hope I can show you this real quick. Um, Here, if I go like that and I go slice and I go like this, yes, that's what I'll be talking about in the next video. You'll have the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa, and you can see most of those foramenas. If I dive in here, you'll see lacrum, you'll see I think that was ovale. You'll see spinosum. You'll see rotundum right here, and so many of them. You can see here the condylar, and you can see here the foramen magnum. We just see the opposite side of it and what make up those cranial fossas, because that's where the brain sits. Oh, sorry, I just did that into the camera. That's where the brain sits, and we're going to learn about the different features of every single one of them. All right. I've talked for so much. I have a headache now. But I hope this was useful. Please reach out to me. You can look at different sources related to the skull because you need to know different views. My views are not enough probably for some of you. But if you have Sabota or you have my notes or you have whatever source you're studying from, always nice to look at the skull from different regions and how people explain it. So this is the end of the video, and I'll see you guys in the next video discussing the internal parts of the skull. All right, guys, have a good day.